I'll just run through what my gear is looking like at the moment. Obviously boredom has set in, as one can imagine, and I'm only on the front line for animal rescue at this stage, as I'm high risk, as some of you might know. So yeah, let's go through it. So this is the main jump bag, which basically has the drugs in it. It has different types of airways in it, and also first aid and a lot of splinting equipment, which you'll see as we go through. We've got lighting, we've got some protection over here. Over here is the tactical belt, which I don't use too often, but yeah, the nice thing about this, strong, sturdy, clips onto the waist. Over here, general purpose gloves, normal medical gloves, put your masks in here, or any equipment that you might need on a specific call. At the back here, rescue knife, which is very cool. It's got a punch, so you can break windows, seatbelt cutter, and general purpose knife for cutting anything that you need. Obviously not a surgical thing. Quite a nice tool to have. Of course you have several of them, and then unfortunately in this day and age you need protection, so the baton here, which normally doesn't come out at all because it's a medical call and not a tactical call. And then over here we've got a normal nebulizer. In here, you'll see is just basic roadside assistance, some swiftwater rescue equipment, not proper equipment, just happenstance equipment. Then going to the back here is all of my snake catching and animal capture equipment, and then obviously the first response vest, which I've got my comms. You've got pens, torches. We'll have a closer look. This is basically the go-to before everything goes on, and it's the first port of call when treating. And then obviously this is my go-to cap because it's got built-in lighting, which is fantastic. You've got a hands-free environment, offers some protection if it's raining, and also sun protection as well if you need it during the day. Okay. There's nothing fancy about it. Some equipment can go in the front here. Generally don't really use it because it doesn't fit nicely into the little box at the back of the bucky, but just open it up. Very, very simple. Nice easy storage, good sturdy frame. So I've got a hard hat just in case you're assisting in extrication. It's not a proper extrication hat, but it protects you from the little bump and the annoying things that do happen if you're on the roadside. Obviously duct tape, which is always fantastic. It's great to just hold things in place if needed. It's great to write notes down. Then in here, just simple strapping, which is always good if you need to strap something down. If you need to strap something to a tree like a rope or anything along those lines. Then got various types of rope, not climbing quality, but again if you see someone stuck and you know that there are no other crews that are immediately available, you can start sending lines across the river just to try and help the person. Jumper cables, tire inflation, so that's pretty basic. I need pop-up cones and things like that, which are still on backwater. This is just a normal nebulizer. As you can see, it's had a couple of dings and dashes. Runs on 220 volts, which we have an inverter inside the jump bag, which you can plug into any vehicle. If you need to administer any roadside and you don't have oxygen on hand. It's very simple. You put the line in there, switch it on and off, and that's it. Nothing much to it up until we get to the big boy here. Okay, with the vest on, see it's a little bit bulky. But this is for when you arrive on scene and you don't really know what to expect. You've got everything on hand immediately for critical care treatment, in particular trauma. This whole system is based on an ITLS protocol. So starting up over here, we've got identification. Don't work for neck care anymore, so I need to cover that up. But at least it has who I am on there. Then I've got comms over here, which is normally in vehicle. Normally just have it on when I'm arriving to scene. When I arrive on scene, if I need to talk to other crews, talk to dispatch or any doctors or any other assistants, then at least it's hands-free. I can do what I need to do without being compromised. Just an emergency set of goggles. As I said, it's primarily for animal rescue at the moment with COVID-19. So if I encounter any spitting variety, either cobra or wrinkles, anything like that, my eyes are protected. It's also very good if you arrive on any trauma scene. It prevents blood splatter, and it's just right on hand over here. Then next in line is just a torch. You can use it in different functions. It's really, really great. If you need extra lighting on the cap, just drop this down. Any extra lighting on the cap, the nice thing about this torch is, well, you've got it again, your hands free. It helps with search and rescue. You can use this as your primary light to guide you, and you can have a secondary larger light to expand the search if needed, and also again with the animal rescue side. Now, all of this stuff is designed to get off you very quickly, but it's always a living nightmare to get it all back in. So over here I have 2 pens, just in case one fails. You need to take down all the necessary patient information, sample history, all of that, the vital signs and so forth. You have 2 pens in case one runs out, so you never want that to happen. Secondly, got another knife. Again, it's actually a hunting knife, but you still have the option of cutting seat belts and so forth. Very nice blade, lasts very long. Also helps in a search and rescue environment. Down here, back to comms. Unfortunately, these pockets are getting smaller because the phones are getting bigger. Waterproof casing in case it rains. It's always a must. Like I said, it goes up easy and comes in badly. Then top pocket, you got your normal basic rescue grip gloves. These aren't cut proof or anything like that. Just helps you if you need to grab things working with rope. You've got nice textile dexterity. It also prevents a little bit of pathogens, like blood or vomit or anything getting on your hands if you're doing an extrication or assisting with an extrication. I need to get a new set of extrication gloves. And then obviously your big bag of medical gloves, which you go through a lot on the specific scene. Then going back down to here, you've got your first set of trauma gear. So it's 3 different pads. You immediately jump to these if you see any profuse bleeding, and you start using these to stop it. Then on the left hand side here, you've got your diagnostic equipment, assisted needles and syringes in case, tourniquets in case you need. You've got your pupil torch, see the GTS, and also checking down throats, things like that. Basic thermometer, and then obviously the BP cuff, which pops out at the bottom here. So this is just basically diagnostics. And then in here, space blanket if you find the person's getting hypothermic, if you're doing a water rescue or winter rescue or something like that. The syringes are very good because you can use things just like a normal bottle of water if you need to spray out contaminants in the eyes and so forth. If you need to do it quickly. I need to get a new vest here. This is getting a little bit old. Then right hand side over here is your rescue and trauma pouch. It's got your trauma shears, you've got another rescue knife, CPOC cutter, you've got your scalpel if you need to cut things like umbilical cords and things like that. Generally not used. You got just basic burn shield here for immediate burns. You can start smearing it on, etc. And then a little trick that I learned at ITLS is condoms. They're really great for the stethoscope. If you've got a major bleed, you can still start listening to lungs, and you can do your blood pressure manually without worrying too much about the steth being covered in blood. And if you have to move to another patient, you can just pull the condom off, put the other one in. The only thing with this trick is you have to practice with it. If you don't, you can start pulling the condom funny ways, and you actually will create sounds that actually aren't there. But a nice little trick for roadside. Got basic bandages here, and down here you've got your gauzes, your major pads. So you've got your big surgical pads. This is for major bleeding, so you stop it as fast as you possibly can, and then you go to the big bag when you've got either assistance or you've controlled the bleeding enough that you can actually start working on getting the more precision equipment available. Then on the inside over here I keep my steth, and there's another one coming in on for the big jump bag soon. Dual head, a single head. I like single heads because they're easy to work with, and they're quite cheap. I would love a Littman one day when I'm big, but I don't actually practice anymore. My license is long gone, so fortunately I just fall under first aider and have to fall under my qualification. Then on this side I just keep a lot more gauze, bigger pads, things like that. Again, very easy, quick to reach. Just to stop all major bleeding. And then you've got pouches at the back if you need any more gauze or anything like that. I find them uncomfortable if you start putting gear in here, especially if you're traveling quite far. It can be a bit restrictive. So this is the first response tactical vest. Like it a lot. It's nice. You can get to everything very quickly and easily. Next we move over to the big jump bag. There's not much to explain about the snake hooks. Just got one set of tongs, 2 large snake hooks, 1 small snake hook at the back of the jump bag, which always goes there. Just easy to reach in case you are responding to an animal call, which has a medical element. No matter what size animal it is, if you train correctly, you can actually move it quite easily, quite quickly. Even really large black mamas, you can use that hook. Okay, moving on from the vest, we get to the jump bag, which is your secondary piece of equipment, which obviously goes with you the whole time. Normally it's set up for trauma for me. However, now with COVID-19, can't see me clearly, but it doesn't matter. You can hear me. With COVID-19, I've now set it up for airways and things like that, as you will see. Starting off from the back, as mentioned before, just basic snake hook. It's very easy to grab, very easy to put back in. Also very great to just have around to make sure that you're not bumping into things when you go in. Otherwise I'd have a tendency to lift my head up too quickly, so this goes up high, which is always great. Here, got body armor, which in a situation is always good, especially if you go to location, you can wear the body armor underneath this. Otherwise, if you are in a tactical situation, this does protect you if you're wearing it on your back, if you are being shot from behind, which probably never ever happens, but always good to have. Often in other cases it will be used as a laptop pouch You know, if I'm going away or something, I always take my bag with me. It seems to be good luck. Swinging over to the front here, on the main front pocket, again, more lighting. Got a nice present from my family. It's very effective light. You've got your red strobe, which is good. It's magnetic at the bottom, so you can put it on your vehicle. You can basically put it anywhere. And you've also got a front light, and this is a very surprisingly strong light, great for search and rescue. Then you've got your normal headlamp, which I don't use very often. The nice thing is it's got different settings, which is, can come in handy. Then got air traffic and normal traffic controls. Supposed to have 2 of these. Unfortunately, I won't go into it, but somebody broke it. But this is when you're landing a helicopter or if you need traffic to go by. Generally, this comes out as soon as other crews on scene. I hand over the patient for better care with ILS and ALS, and then I generally stand on traffic duty, clearing people away, making sure that the scene's safe for the crews to operate. Always very valuable. You can't have enough lighting, enough reflection. Then over here, in this one, I always carry these with me. My knee pads, especially if you're doing roadside assist. If you're doing CPR, you know, your legs get very tired, especially if you're dealing with a larger person. That you just can't go into the knee, the leg down position. And then again with COVID-19, we've got a set of scrubs that I'll put on call. It's really to protect myself for when I come back from a call. Then I will go into decontamination, which is a very smelly, horrible mixture of meths and jick, and it's just nasty. Under high pressure, it goes through everything, and being scrubs, you don't really worry about them being stained. It's not a fashion statement, it's protective wear. So these are invaluable, from a very good friend of mine. Going on top, normally this is rescue equipment, but I've had to modify it because of COVID-19. So currently it has got my current mask. I've got a new one on order. It should be here in a few days, along with my O2. Not very comfortable, sound like Darth Vader, that has got a very terrible wheeze, very difficult to talk through, and it's also one of the reasons why I've gone for the better one. And it comes with a matching set of goggles, which are completely sealed, so you can't get any contaminants coming in. The nice thing with these goggles is you've got little breathing vents that allow a little bit of moisture going out, but doesn't seem anything can come in. I've already worn this with one decontamination and didn't feel any burning sensation on the eyes and smelt nothing through the mask up until everything came off and had to go and do my nice lovely soapy shower. So this is on top because it is completely critical on a call. And inside it there are alcohol swabs because you want everything clean before you put it on. You want everything clean when you put it on, and you also want to clean everything as you take it off. There's a special way that you actually put them on and off, because it's all fantastic. You wear gloves, you can touch a lot of things as you're taking it off. If you do that, then it kind of defeats the entire purpose of wearing PPE. Okay. Drop these here. Moving on to the side pouches. On this side, I've got my snake bag. So if I do rescue an animal, it's immediately available. This is a secondary thing that you go for. The first thing you need to do is work the animal with the other tools, the tongs and etc. And then once the animal's tired out, then you can get yourself or get preferably someone else to reach for the bag and get the snake bag out, and then put the snake in and transport and release. Also in here is the power pack for the nebulizer. So if you are on scene, you need power for some reason that you can't have power. If it is a car accident or something and you can see that the person is either having some kind of reaction or you need to administer asthmatic medication, it comes in very handy. You can either plug it into the vehicle that has already had the incident, or you can, if the patient can move it to your vehicle, plug it all in, and you've got full 220 volts, I think it's 5 or 6 amps, and it can sustain quite a long time until other crews arrive. Always a very handy thing. Most often used to charge phones and laptops. And on the other side, we've got our bone gear, splinting, C-spine. Again, it's another very tightly packed piece of kit. Over here, you've got your same splint, which is great for everything. You can use it as a C-collar, you can use it as just normal splint for the leg and bandage. It's malleable, but also quite rigid as well. Always a nice thing to have. Then you've got C-spine over here, adult C-spine, and these are more of a warning that there could be some deformity or some injury to the spine. These are not to immobilize the patient. That you need spine board and head blocks. But this is a good way just to keep that chin up in a rested position, and it limits the movement that the patient can do. But I have seen on a couple of times people actually moving so much from head injury that they can actually break out of these things. So they're not that steady. And then you've got your normal hard splints, which can either be put together both on the arm, or you can connect them for a longer limb like the leg, etc. And then obviously you've got the bandages to secure it in place. Let's see, back in there. Okay, so this is the outside of the pack. Let's go to the front. This is airlines and for first aid. So up here I've got my nasal cannulas. Over here I've got my, show you them. Okay, so nasal cannulas. This is just for low airflow with oxygen. Just in case we are waiting for crews or a bed at the hospital. That's what it's there for. Then next down, we've got non-rebreather mask for high flow oxygen. You basically put it to 100% and just apply oxygen while you're starting to get all the drugs prepared for pneumonia or asthma or anaphylactic shock, things like that. And the bottom one, we've got a full set of nebulizers, nebulizer mask, and also a mouthpiece. The mouthpiece is very good at the moment with COVID-19 because you generally have a sort of a high flow of oxygen, about 6 to 8 mils, and that can aerosolize the virus as the patient breathes out. The nice thing is it aerosolizes back into the chamber. But there is another trick with the mask, which I will show you on the O2 video when the O2 comes. So those all got in here. Then on the trauma side, got a kit of basic first aid bandages. These aren't for your initial major bleeding because that is all stuck in here. You just literally apply pressure. You then go to these once you got bleeding under control, or you have a second helper, all nicely laid out on the ITLS, from your small little injuries up to your major head injuries. Again, also got a lot of alcohol pads sterilize absolutely everything when you open it, when you apply it, and so forth. Linen savers over here, they are invaluable, also very good because I've got one in this pouch here and on the, sorry, not the outside, on the inside. They are great for major unknown bleeds. If you've got major head trauma, you can just start patting it down, controlling the bleeding, cleaning up the bleeding, and then seeing where the actual bleed is coming from. I've seen them in action, worked with them. They are fantastic. A strange piece of kit that's never in any first aid box. So yeah, that's going from the trauma side. Airflow side, airways and drugs, and a bit of trauma control and diagnostics. Start off with diagnostics. So green part is for blood pressure. It's automated BP cuff, which always helps because you don't need to constantly use your steth. Although I prefer doing it manually because I find that doing it automatically does come with its problems. You can't actually feel the rhythm. You can't see, intuitively what's really going on, but it does give you what you need. They work very simply, and then attached to that is your pulse oximeter, which just goes onto the finger and it gives you your pulse rate and more particularly your oxygen saturation, which is critical when it comes to COVID-19. This diagnostic set will also help you in line with your steth, what kind of treatment you need to give, how much is required. That I will obviously have on the dose protocol. The next one is also diagnostics. So inside this pouch, tongue depressors, so you can see what's happening in the throat. You can see if any redness, if there's any tonsillitis or anything. Can also be used by putting airways in. I generally don't use them. I'm still waiting for my new airway set. I just normally go from the cheek in to get the airway, but also a good way to check for gag reflex without putting your fingers inside somebody's mouth. Then you've got your thermometer, which goes into here. All the wonderful wavy ones, all sold out, and these are just ear protection that you just pop it in, take one out, diagnose, get the reading. If you're actively working with a patient, a single patient, then you can just keep using the same one. If you're using multiple patients, then you need to keep changing them, obviously. Then again, pupil torch, invaluable, light's always good. This is used to check the throat for anything, especially if it's an anaphylactic thing. You want to see if there's any close-up or anything. Normally you can see it just normally visually, but it's always a good idea to check. There can also be blockages and things like that. Then you got your disposable mouthpieces for peak flow meter, and again, a respiratory thing. You use it to constantly diagnose, to check lung function of the patient. And then we go to this one, not to do with COVID or any first aid response, but this is for sports medicine. You can check the BMI of the patient, things like that. Normally use it for myself and get very depressed when I get the readings, but always good on hand, especially if you're sitting watching a sporting event and assisting in those, which I've done a few in the past, which is not too bad. Going back to the trauma, here is a small trauma kit. This is normally for digits, and also you can use it for GSWs. So inside here You've got your normal digit dressing, which is basically an elasticated bandage that you just put over the finger or the toe. Very, very useful. Just normal plasters with an elastic roll. And then you've got your gauze with your prep here. Gauze is very, very good for a lot of things, and in particular, if you've got a GSW, you can use them to start packing the wound. Then on the back here, you've got your steri strips and surgical dressings, which are very good, a good substitute on scene for stitches. You can just start closing up the wound, and then when they get to your hospital, the doctor's room, then the doctor can decide whether this is good enough, or if stitches need to be done, or if the wound needs to be open, etc., etc. And then obviously an antiseptic, and that you use on absolutely everything before you start dressing a wound. Next up, for your resus, you've got your suction. It's a manual suction device. It's basically after resus, with CPR, you're obviously putting a lot of pressure on the chest and abdominal region, and more often than not, people vomit, and you want to get it out of their system as quick as possible. So any kind of fluid that you find in the mouth, you use this to get it all out. You don't go down into the throat with it, but you basically go to the side, like a dentist. You can even go slightly past the uvula depending on gag reflex, but it is not designed to go into the throat like some suction units can. Your more automated ones have special nozzles for it. Then moving on to drugs protocol. Up here. So at the top here, we've got syringes and needles for administering drugs into your nebulizer. These are not designed for going into the body. I can show you just one of the needles. The gauge is massive. It's bigger than a toothpick going into you, so don't use it for that. They're just nasty. Then the other pouches are currently empty, so we're not hooking up any IV lines or anything. Then over here we got the drugs pouch. Open that up for you. Easy labeled, knowing which drug is which. This is purely for COVID-19. So over here, the normal saline. So this is where you use the needles, you extract from blue. So you put it in, and the blue side has got an automatic seal because these are vacuum packed. So you can just draw what you need, put it into the neb, and they work great. These are the small ones because often they expire, and on any given call you should not use more than 100 mils of normal saline before you get back up to arrive. The rest of the pouches are currently empty. Normally they would have sports medicine inside it. Things like, actually this one is a hydration pouch. So you have rehydration in it with a sealed bottle of pure water. And then you've got your topical medication in this one, which is all gone out because I'm not very active at the moment, so I don't need it, and not attending any sports events. Next one is your airway and invasive trauma. I'm still trying to work out where I'm going to put those. But at the top over here, you've got, well, just on the basics, you've got your razor blade if you need to start attaching AEDs on it. Inside here, which will move as soon as I get it, is your airflow regulator valve for the oxygen tank. And then inside here you've got your sort of tweezers, clamps, things to pack wounds with, etc. They need to be sterilized before operating. So I've got tons and tons of surgical prep pads, and then your 3M tape, just to hold things in place if needed. In particular, if you're clamping a major artery or something with these clamps, then you need to hold them in place while you can actually work and treat, and wait for your advanced life support to arrive. Adult BVM and child BVM, which you just hook up to the oxygen line and start your protocol on that. And that is basically the whole trauma and COVID-19 gear that I'm currently carrying. I will do an expanded video when I get the rest of my gear, and we'll go into more detail on how it all works as we get more and more horribly bored. Right. Cheers.